Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. I truly appreciate you deciding to come spend your Saturday morning with us here to learn how to improve your health. This is the show that's designed to be more than something interesting to listen to. The purpose of this show is to give you real-world solutions to today's most complicated health problems. I'm going on my 22nd year in practice, and I've been on a 22-year quest to help as many people as possible live a better life using drug-free solutions to today's worst health problems. So welcome to the show. On last week's show, we discussed something that's very important to the people of Acadiana, and that was chronic pain. And I ran out of time on last week's show. My goal was to give you 5 solutions for chronic pain that you had never heard of. And because I like to talk too much, we only got to 2. So we're going to continue that on this week's show and give you those other solutions for chronic pain. But guys, this is very important. Do you realize opiate addiction is up 500% in just the last 7 years? 91 people a day now die from opiate overdose. And if it hasn't touched you directly with either someone in your family or one of your friends, it probably has touched someone that either you work with or that you go to church with. This is getting to be way too common. And 91 people a day that lose their life because of problems with opiates. And so we need better solutions for pain, for chronic pain. And many times people don't really think that they have chronic pain, that they just have occasional pain. But when you really start to add up how often they do suffer with pain in their body, it really does turn out that they suffer with chronic pain and just don't really stop long enough to realize that. America now takes 50% of all the pharmaceutical drugs on planet Earth, and we're just under 4% of the world's population. So 4% of the world's population takes 50% of all the drugs on the planet. We have more doctors and hospitals than any other country in the world, and we spend more on health care than most of the rest of the world combined, yet China and Cambodia have a longer life expectancy than we do in the United States of America. So if the answer to achieving a long, healthy life was more medicine, more money, more doctors, and more hospitals, wouldn't we have the longest lifespan of any other country in the world? Yet it's far from it. Many, many other countries have a longer life expectancy than we do, including Cambodia. Some places in Cambodia, they might be miles from any hospital or any pharmacy, yet they outlive us. And so this show is about how we can turn this around. The only solution for the healthcare problems that we have in America is wellness and prevention. The only answer to cut our healthcare costs is an exact 180 degrees from where we are headed. And that doesn't just apply to our healthcare system. It also applies to you as an individual, you with your suffering and with your diseases and your health problems. It's 180 degrees from where we should be going. So on last week's show, we were discussing chronic pain. And my goal for that show was to give you 5 new technologies for chronic pain. And so I promised all of you that we were going to have a second show on that. And right after this next break, we're going to get into that. But it doesn't matter if you've been diagnosed with fibromyalgia or arthritis or migraines or rotator cuff tears. It doesn't matter what it's been labeled as. There are some commonalities that you can use to treat almost any kind of pain in the body, because there are some common things that people with pain have that aren't getting addressed that many times can help patients that have been suffering with chronic pain for years, no matter what the label, whether it was called fibromyalgia, migraines, arthritis, or whatever, even this silly bone-on-bone thing that I talked about last week on the show. And by the way, if you guys missed last week's show, you can always go back and catch that on KPEL's website. You can go under the search bar and just put Get Well Acadiana, and you can pull up all of the shows from the past. But it doesn't matter what you've been labeled as. Pain has some commonalities in the body. And last week we also said that the pain itself is not even what's wrong with you. Pain is a signal that your body sends you telling you damage is being done. It's not what's wrong with you. It's telling you something is wrong with you. It's like your check engine light on your car coming on, telling you there's a problem in your engine. So you could put tape over that light and ignore it, but you would never do that to your car. But that's what people do to their bodies, sometimes for years, by just popping 4 Advil in the morning and ignoring it, or relying on these opiates and never really addressing the underlying reasons that they're having pain in the first place. But remember, the pain is not the problem. It's whatever's causing the pain that the problem is. You know, if I touch a hot stove and I feel pain shooting up my arm from that, I could inject that nerve and deaden it so that I didn't feel it. But that wouldn't really make a lot of sense. That's never actually solving anything. That's just covering up my burning hand. Tissue is being damaged. And it's the same way throughout the whole body. Now, the other big problem that I see, and this is something that I was teaching also about on last week's show, is what we call behavioral adaptation. Well, Doc, I don't garden anymore. I used to love to garden, but I just can't do that anymore. No, Doc, I don't go for my walks anymore. I used to walk a half a mile a day, but I just can't do that anymore. Oh, no, we don't go dancing anymore, Doc. I can't dance anymore with my spouse. Pretty soon, this person is just existing. They've literally adapted themselves out of any enjoyment, or really they're just living. They're not really doing anything that they used to enjoy because they have pain, and pain is limiting them from functioning. And that's such a shame, especially when natural solutions exist in order to solve these problems. Now, the other problem that I see very often with this is sometimes people even feel like they've gotten the answer to what's wrong with them as long as the doctors labeled it as something. So in other words, they feel like, oh, I figured out what's wrong with me. I now have, arthritis, or I have rotator cuff tear. So a label doesn't necessarily tell you what the underlying problem is in the body. I'll give you an example. I was having a phone conversation with a very nice lady one time to try to see if I could help her. And she was describing this terrible pain that she was having in her head. And I was taking notes. And after speaking with her for about 5 minutes, at the bottom of my notes where she was describing where her pain was and when she would have these headaches and how often they occurred, and at the bottom of my notes where I was talking to this nice lady, I wrote probable temporal headaches at the bottom of it. And so she was busy at the time, so she asked me to check back with her in a couple of weeks. So a couple of weeks later, I gave her a call to check on her to see how she was doing. And she said, "Oh, no, Doc, my headaches got worse, and I figured out what was wrong with me." She said, "I went to a headache specialist in Houston, and I spent 3 days over there. And finally, this brilliant specialist figured out what was wrong with me." And so I'm expecting her to say, okay, well, maybe they found some kind of pituitary tumor or something really rare. She said, "This amazing doctor figured out what's wrong with me. I have temporal headaches." I literally almost fell out of my chair. I wrote that after a 5-minute phone conversation with this nice lady. But she thought because it had been labeled as something, she had found out the problem, or what was finally wrong with her after all these years, because it was given a label. I'm not really big on labels. You have to find out where these problems are coming from and solve that. So I followed that up with, well, did they find out what was causing the temporal headaches? And she kind of paused and she goes, well, no, they kind of said that just happens sometimes. Can you guys begin to understand why I get so frustrated and I'm driven to help as many people as possible? It really is a nonsense to label something that doesn't solve anything. This lady probably went and spent $20,000 or $30,000 to find out that she had quote unquote temporal headaches, but never found out why. We have to begin to figure out the why. And so in my program, we keep digging until we find the very underlying causes of what's eliciting the pain response in the body in the first place. How do we continue to boil down layers and layers of issues until we get to the original underlying cellular level itself? And that's what my program is all about. Now, before we go to break, if you want to have a phone conversation with me about your individual problems, I'm doing complimentary phone consultations for all of our listeners next week. And I'll be more than happy to give you a call on the phone Monday whenever I get to work about your condition to see if I think my protocols would help you. The number's 837-7174. You can just call my office. Obviously, it's Saturday morning. I'm not at work today. But all you have to do is leave your name and number on the machine and say, I want Dr. Kevin to call me back. And when I get to work Monday, I will personally call you back and we can have a phone conversation about what's going on with you and whether or not I think my program would be a good fit for you. And if I ever don't think it is, I won't waste your time. The number's 837-7174. That's 837-7174. This is Get Well Acadiana. I'm Dr. Kevin, and we'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Today's show is on some of the most amazing new advancements for chronic pain in the body. And my goal for last week's show was to give you 5 new technologies that you've never heard of before, but that are tremendously effective for chronic pain patients. And so we're going to do that on the show today. We're going to finish up those 5 things because I got through 2 of them last week. And because I like to talk too much, I ran out of time. And so we're going to finish up those 3 things on today's show. But one of the things we said is labeling is not an answer. Going to a specialist to get a label and thinking the whole thing has been figured out is really not a very smart way of looking at your health or at your future. The system of healthcare that we have that puts so much emphasis on a label is one of the reasons why our healthcare system is in such trouble. Think about this for 1 second. If your sinuses are all stuffy and inflamed and red and your nose is red and your sinuses are all stuffy and you go to the doctor and he says, well, you have sinusitis. Itis means redness and inflammation. And so basically you've been diagnosed with inflamed sinuses. Didn't you kind of know that already? Isn't that kind of why you went in the first place? So does that make a lot of sense? Or if your stomach's all achy and inflamed and you have stomach pain and you go to the doctor and he says, well, that's gastritis. Gastro means stomach and itis means pain and inflammation. So it doesn't really answer anything to put these labels on everything. You know, patients tell me all the time that come in, they'll go, Doc, yeah, my other doctor thinks that it's sciatica. Well, if you look sciatica up in the medical dictionary, it just means pain or numbness down the leg. So if the patient has pain or numbness down the leg, it's not rocket science to call it sciatica. You got to figure out where that's coming from. So do you guys see that that's kind of silly? And that's one of the things that motivates me to try to get away from just these labels that you could look up spending 5 minutes in a medical dictionary, but to actually figure out where the underlying problems are coming from. So we can get to the solutions that can actually change this patient's life. So it's time for an entirely new approach. We need to move beyond labels and diagnoses. And my protocols continually ask the questions of, well, why did that happen? Okay, we figure that out. Then why did that happen? Until we get as far upstream as possible, till we get it down to its finest point. And that, ladies and gentlemen, is where the answers lie. That is where your solutions exist. To keep digging until you get down to the very cellular level itself. And then we ask ourselves, why is the body doing what it's doing? And how do we get it to do something better? How do we get them to perform different? How do we make that area of the body work better? And that's the big difference in what my philosophy is and what other philosophies out there are, is we really want to try to get to the underlying problems. And it just naming it and putting and labeling it is really not the best solution for that. And so we've got to get away from that in America. You know, if I asked you, name a disease or a condition that's been cured in the last 50 years in America in healthcare, go. Doesn't have to be a big one, anything. Just name anything that has been solved, however small of a condition, in healthcare in the last 50 years, go. Like roll the crickets chirping, right? So this is my passion. This is what drives me every day to wake up and do my very best to find the most effective technologies and techniques out there to help as many people as I possibly can without drugs or surgery. So on last week's show, we covered 2 new technologies that I wanted to review really quickly with you. In case you missed last week's show, you can go back and listen to it. But I just wanted to review real quickly what we talked about, and then we'll move on to these other 3 amazing things. Now, the first technology we talked about last week was called rapid release. Rapid release is very effective at breaking down scar tissue. Scar tissue happens from tissue that is damaged over time. Now, people think that they've never had any traumas or damage. The truth is, people have a lifetime of little small injuries and damage and tears and sprains and strains that didn't seem like a big deal at the time. Maybe they were sore a day or 2 and then it got better, but it was enough of an injury to develop micro tears, scar tissue later in life, and something called fibrous adhesions. So the average person has actually had 1,000 little small physical traumas to their body that they didn't think was a big deal at the time, but actually was enough of an injury to create these micro tears. And that forms scar tissues and fibrous adhesions. And these are very, very painful. And sometimes you can feel these like little marbly, tough tissue under the skin where you have your pain. If you rub your fingers across the tissue, you can feel like these little marbles or pebbles in there. These are from old micro tears, and they are a great source of pain. They're like little knots in the tissue, in the painful tissue. These are from micro tears that were never addressed, and they are loaded with pain receptors, and they're very, very painful to have. Now, rapid release can specifically target these fibrous adhesions and cause them to break down and to remodel into healthier tissue. Rapid release resonates at the same frequency that causes scar tissue and fibrous adhesions to break down and go away. But these fibrous adhesions are a huge source of chronic pain, and we see these loaded up in chronic pain patients. And so you have to address this old, tough, fibrous scar tissue if you're ever going to get that person to get their flexibility back and their range of motion back and decrease their pain to a level where you can give them their life back. Now, rapid release is really amazing for chronic pain, and even it's great for people that have already had surgeries, because there's nothing more scar tissue forming than cutting your tissue open and changing something and repairing something in there and then sewing it back. And, you know, every doctor pretty much agrees that scar tissue is a great source of pain, and this rapid release technology is great at reducing this scar tissue. Now, the second technology that we talked about was this dry needling. Now, we kind of laughed last week and said I would have named it something different. You know, if you ask anybody if they want to be dry needled, it doesn't sound like something that you would want to do. But the truth is, it's remarkably effective at reducing chronic pain. And what we had said about that was whenever an area of the body begins to go into pain, say you hit your elbow and it goes into pain, the body's response to this is to tighten and splint the tissues around that as a protective reflex. So we talked about the difference between acute pain and chronic pain. Acute pain means that you hurt for a few minutes and then it goes away. You know, you stump your toe, it hurts for a few minutes and then it gets better. The difference between that and chronic pain is sometimes whenever an area of the body starts to hurt, this contracting and splinting mechanism overreacts and contracts too hard, so hard that it actually pushes the blood supply and the oxygen out of that area, which makes it hurt worse, which makes it splint and tighten up worse, which pushes more blood flow out, and now you have this downward spiral of pain and spasm. Now, the solution for this is I can take these tiny little acupuncture needles around this area, and when we begin to insert acupuncture needles around this splinted area, it increases blood flow, increases oxygen, washes out all of these painful chemicals in that area, and it begins to reverse this downward spiral. And I went way more in depth on that on last week's show, but I just wanted to recap that with you. My goal was to tell you 5 new technologies that are helping thousands of people right here in Acadiana get over their chronic pain once and for all. And on last week's show, I got 2 and I ran out of time. So I'm going to talk about the other 3 on today's show. And we're going to start that right after this next break. But if you're listening out there to the show today, and you have pain or health problems that you have not figured out why that's occurring, I don't care if it's been labeled or not. If you haven't figured out why that's occurring, I would love to have a phone conversation with you to discuss it and see if I think my protocols and technologies might be able to help you. And so we're doing complimentary phone consultations to all of our listeners next week. I've set aside a lot of time for this for next week. And if you're interested in that, all you have to do is call 837-7174 and leave your name and number on my voicemail. Obviously, I'm not at work today. It's Saturday morning. But you can leave your name and number and just say, I'd like Dr. Kevin to give me a call back. And I personally will call you Monday and we can have just a 5-minute phone conversation about what you have going on and what I think we could do in order to try to possibly help this for you. That number's 837-7174. That's 837-7174. We're going to tell you these other 3 amazing new technologies right after this next break, so don't go away. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me. We are in the middle of a discussion on natural solutions for chronic pain. And here's the thing to keep in mind with this. You don't have to find that one magic thing that's going to solve all your problems. You don't have to find that one magic bullet that's going to go help everything that you suffer with, because the truth is there's not one. The body is too complicated for that. There's never usually just one solution to try to help you. But you know, if I do 5 things to try to help you and each one of them just helps you 20%, we're all the way there. So we don't have to find this one big answer that's going to solve all your problems. We just have to do enough technologies and techniques out there to try to help you a little bit. And we stack them all together. And pretty soon I get 10% from this thing, 15 from that, 30 from this thing, 20 from this. And it adds up to real solid relief. And that's more like how our protocols work. It's not that we have one magic answer for everything under the sun. It's that we put a comprehensive strategy together from some of today's most effective treatments out there, the most researched effective things that you can do. And we stack them together in one comprehensive program. If I do 5 things to try to help you, and one of them I was completely in left field, I was crazy, made no sense to do it, didn't help you at all, but the other 4, I hit my mark and they each help you 20%, you could be 80% better from that. So that's my point here. If we get 10, 15, 20% from everything that we do, and we do it as a strategy, as a comprehensive strategy, we can make huge results in your chronic pain by just doing a multitude of things and trying to get the best results off of each one of those. Now, the next thing that I wanted to talk to you about, guys, and this is a big one. This is one of these 5 new technologies. So we did rapid release, we did dry needling, and the third one that I wanted to introduce to you today is something called cold laser therapy. They are now doing some amazing things with laser. Now, first of all, I need to tell you guys, these lasers do not burn you like the ones they take tattoos off with. It's called cold laser because the strength of the laser is just below the burning strength of the laser. So it's called cold laser. And they have figured out how to tune a laser beam to dramatically reduce chronic pain syndromes in the body. One study published in the American Orthopedics of Foot and Ankle found that low-level laser demonstrated results for treatments of acute and chronic pain, and the mean improvement was 67 out of 100. That means that 7 out of 10 people got relief from these new cold laser therapies. Another study in the Journal of Physical Medicine and Rehab, October 2004, to investigate laser therapy on the effects of stress proteins from chronic pain, found it to be tremendously effective at reducing these stress proteins. I've got a file cabinet full of research on cold laser, and I'm not going to bore you guys with all of that. You know, I know you guys don't enjoy looking at research. I do. I'm kind of a research nerd, but cold laser affects chronic pain at the chemical level through something called COX inhibitors. But almost all studies show tremendous promise at using cold lasers on almost any area of the body that's in chronic pain. And fortunately, we have cold laser available right here in Acadiana, in Broussard, to try to help you. It's completely pain-free. It's 100% non-invasive with really zero side effects. I mean, it's a tremendously effective thing to do. And when we couple that with the rest of the protocols, it starts to really make sense how we can solve patients' problems, even if they've been everywhere else, even if they've tried something and it's only helped them 10 or 15%. And then the next thing that I wanted to talk to you guys about, and this is a big one, and this is disc problems. So many patients are suffering with disc problems. And you know, disc problems are something that not enough is being done to try to help these people without surgery. So I wanted to cut to this next break really quickly, and then I'm going to dive into disc problems and MRIs and what all that means and what we need to do about that right after this break. But if you want to have a phone conversation with me about your individual health problems, my office number is 837-7174. I'm doing complimentary phone consultations for all of our listeners next week. That number is 837-7174. All you have to do is leave your name and number on the machine. Hey, I want Dr. Kevin to call me back, and I'll give you a call Monday, and we'll have a little conversation about what's going on with you and what I think I can do to possibly get you some relief finally, once and for all. So we'll be right back after this next break, and we'll go through all the details of disc problems. Welcome back to Get Well Acadiana with Dr. Kevin. We're deep in the discussion about chronic pain today, and I know thousands of you out there listening are suffering with pain. And I want to encourage you not to just pop your 4 Advil and keep going every day. That is not ever going to answer what's going on with you. Or don't suffer through it, or don't adapt yourself out of all of your enjoyments because of your pain. Keep looking. There are doctors out there that are coming up with new answers that you've probably never heard of for these chronic pain syndromes. And today, we're discussing 5 new solutions out there in order to try to help you. And right before the break, I was saying that we were going to get into disc problems. And I could actually do a whole show on nothing but disc problems. So I'm just going to touch on a few of the ideas and concepts about the spinal disc today. But just know that I could really do a whole show on nothing but spinal problems. Spinal problems are the number one disabling thing in America in people over 45, period. Now, why is that? Why are spinal problems the number one most likely thing that will cripple you if you're over 45 years old and you're out there listening? Why is that? Because no one maintains or takes care of their spine over their lifetime. What do I mean by that? Well, everybody knows to brush their teeth every night and every morning, and knows to get checked for cavities and, take good care of your teeth and floss. And we know to maintain our teeth in order to keep them in good shape. But for whatever reason, no one maintains or takes care of their spine in any way whatsoever over their entire lifetime. It's like the spine is just supposed to maintain and take care of itself. That's not the way the body works. We as spinal experts have done a very poor job explaining to the public that your spine needs maintenance and needs to be taken care of and checked on a regular basis and looked at. I always tell people, if your spine was on your face and you could see it when you would smile, you would take way better care of it. But the truth is, your spine can't just sort of take care of itself. People need to have their spines maintained and taken care of and checked and treated throughout their whole life. So what ends up happening is this. We abuse our spines literally from the time we are born. Many times our first case of whiplash is not our first car accident, but it's when we're born. It's when we come through the birth canal. Think about this. If you've ever seen a baby that was born, their face is blue, they're scraped up on their cheekbones, sometimes their head is misshapen. That's how much force they just went through. And so if you guys have ever seen me post Facebook pictures of me working on little babies, this is why. Because it's one of the most traumatic spinal things we could ever go through. And it's their first introduction into the world, is that many times they'll get some sort of a spinal problem, and then we wonder why they cry and won't sleep, but it's because they're in pain. They just can't tell us. And then the average child falls 200 times learning to walk, and then the bicycle accidents, skateboard accidents, falling out of the treehouse, and then we start football, and then it's poor posture in college, and then the car accidents, and then gym injuries, and then work injuries. So we literally abuse our spines from the time we are born, and we ignore it. We expect it to take care of itself. And then we're 45 years old, and we come in and go, I don't know how I got this way, doc. The average person has had 1,000 physical traumas to their body that they didn't even think was a big deal, but it was enough of a problem to cause issues that needed to be maintained at the time and never were. I see chronic pain patients every day that have been told that their pain is coming from a spinal disc, whether it be a bulge or herniation or ruptures or slip discs, whatever it's been labeled as. So I wanted to spend a little bit of time today talking about disc problems and the best solution for them. And I want you guys to imagine a disc as being flexible like the tires on your car. So a disc, it can move in and out just like your tire can. So imagine if you've ever pulled your car too far into a curb and your tire sort of bulged out on the sides. Well, when you back up, that tire goes back. It goes back to its normal shape. That's exactly how your discs respond. And most people don't realize that. They think once they have a bulge, and that's the only answer. There is now some amazing technologies in order to reduce disc bulges without surgery called disc decompression. The Cincinnati College of Medicine reviewed records from 1,450 patients diagnosed with disc issues, and after 2 years, just 26% of those that had surgery returned to work. 26%. You have a 1 out of 4 chance of going back to work. And that was compared to 67% of the patients that did not have surgery return to work. And listen, I know sometimes it has to be done. But we have a whole treatment program out there for patients that have had back surgery that have failed, but it's much easier to work with someone before the surgery is performed and do what's a non-surgical intervention. And the number one thing we do for that is called spinal decompression. This is one of the true breakthroughs in non-surgical disc repair. This technique was researched by some of the world's leading medical doctors. One was Dr. Norman Shealy, who's an MD, PhD from Harvard Medical School. The other was Dr. McClure, another Harvard researcher, and also Dr. Krimchek, who's the top orthopedic surgeon in the country. Dr. Krimchek is the man where, when it comes to orthopedics, if you're Peyton Manning or you're Drew Brees and you need a shoulder surgery, Dr. Krimchek is probably going to get the call. If you're a Major League Baseball pitcher and you need elbow surgery, probably Dr. Krimchek is the one who's going to fly in and do it for you. So these three researchers looked at decompression, and they looked at it hard, and they found that when done correctly, underlined, done correctly, 92% of the patients got well and avoided surgery. 92%. And after 2 years, the percentage was still 86%, which is unheard of. No other treatment can even come close to that. No other treatment can even come halfway to that. Remember, 26% return to a normal life after surgery. Imagine your spinal disc as if a water balloon. So let's say you take a balloon and you put a little bit of water in it, not blow it up all the way, but just like a palm-sized water in there. And if you're going to squeeze that water balloon in your hand, that water balloon's going to bulge out around your fingers. You picture that in your head? Now, what happens when you let off of your hand? That water balloon is going to go back into your palm. So if you squeeze your hand, it bulges out. And if you let off of your hand, it goes back. This is exactly what happens in the spinal disc. Exactly. And so this spinal decompression is very, very effective. And the way that this works is there's a computer and a table that we can hook you up to. And what it does is it's all computerized controlled, and it puts a targeted negative pressure on that disc that will cause that disc material to suck back in where it goes in order to reduce that decompression. And then get the cool thing about this. If we can get it to do that, the disc will actually form a little scar tissue over where that bulge was, and it will be stronger than the rest of the disc. So that area will never bulge again. This is a permanent solution if we can get it to go the way it's supposed to go. And then we talked about cold laser therapy. We talked about a rapid release. We talked about dry needling, several other technologies out there in order to try to help you with chronic pain. I have so much more I could talk about in here if I had time, but unfortunately, guys, I don't. Once again, we are out of time. But do you guys understand now by listening to these last two shows how complex this is, how complicated this is? You can't figure all this out in a 3-minute office visit. This takes time. We have to dig into the body and figure out a comprehensive strategy to fix all of these problems. And we have to do that as a step-by-step approach using common sense instead of labels. And that's why I don't really do labels. I want to try to find out why the body's doing what it's doing and how can we get it to do something better. Thank you all so much for joining me today. I really appreciate you taking time out to listen to this show and learn ways that you can improve your health and live a longer, better life. If you would like to talk to me about your individual health problems, I want you to know that my purpose, my passion, the reason I get up every day is to try to help as many people as I possibly can live a better life and do what they should be doing and not adapt themselves out of their entire enjoyment and just be existing. My passion is to try to figure out what it's going to take to give you your life back. And listen, if it's not that bad yet, don't let it get there. The sooner we get to these things, the less difficult and the less lengthy and expensive it is to solve them. So there's no better time than the present. If you want to talk to me about your individual health problems to see if I may be able to help you, all you have to do is call my office at 837-7174. We're doing complimentary phone consultations for all of our listeners just this week. It's 837-7174. Obviously, I'm not in the office today, so give me a message on the machine and tell me your name and number, and I personally will call you back when I get back to work Monday, and we can have a little phone consultation to see if I think it would be a good fit for you. And if I don't, I won't waste your time. Thank you guys so much. That number's 837-7174. The number one thing I can say with chronic pain is don't give up. Don't take a label as an answer. Keep digging until you find an underlying solutions to try to help you. And if I do 5 things and each one of them just helps you 15%, you got your life back. We don't have to hit the magic bullet. All we have to do is figure out a comprehensive strategy with some of the best new technologies and techniques available anywhere in the country that we have right here in the Acadiana area. That number was 837-7174. Thank you, guys. We'll talk next week.